Well, Sean, becoming pregnant during COVID presents its own unique set of problems and issues. Of course, every woman and her unborn child want to be kept as safe as possible during this time. The High Risk Pregnancy Center right here in Las Vegas can help women and their families achieve that.
No question. They helped me and my wife bring two kids onto this planet. Lauren Giacobbe, she's joining us now. Lauren Giacobbe, MD, may I add. She's coming from the office that we used to go to over there on Pinto. How are you?
Wow.
Good morning. I'm good.
It's great to have you. I'm thinking back when we got pregnant. I say we as though I had, anything to do with the actual birth.
A little bit.
But that said, that's challenging enough. Then you had COVID into the mix, and I can understand how a parent coming into this, it could be so. What should a pregnant woman know to protect themselves during a time like that?
Yeah, so I tell my patients that they should be following the same guidelines for the general population. So washing hands, of course, social distancing, and wearing a properly fitted mask. And
Yeah.
I say properly fitted because it really does need to cover both your nose and mouth. If it's not covering your nose, then it's really not worth wearing. So,
Yeah.
wearing a properly fitted mask and then social distancing. The social distancing, I think that term can be a little problematic. So I feel that when you say in order to, or you should social distance to prevent the spread of coronavirus, it's similar to saying you should diet and exercise if you want to lose weight.
Yeah.
It's kind of a general term. It doesn't give a lot of guidance. And so I think it's more useful to talk about social distancing with more detail. So, for example, we know, staying 6 feet away or more from other people, especially if you're not wearing a mask,
Yeah.
and also thinking about who you're spending time with. So, there's also there's a great table on the Texas Medical Association website, and it talks about different behaviors and the risk with exposure to COVID-19 associated with these behaviors. So, for example, opening the mail is a very low risk behavior, whereas eating at a buffet or going to an amusement park is going to be really high risk. So I do try to talk with the patients about specific behaviors and not just a sort of term, well, you should social distance. I think that is more helpful.
Yeah, absolutely. Excellent. Well, thanks for covering what women can do to protect themselves during this time. Also, these measures keep them healthy. Let's talk about, speaking of health, what safety measures that you have in place at the High Risk Pregnancy Center when people come to see you.
So, we start off with a screening, just a screening questionnaire. So every patient that comes, we ask about questions, whether they have had any symptoms related to COVID-19 or if they have had any exposure to someone who's tested positive. And then everybody gets their temperature checked. Every patient is required to wear a properly fitted mask from the time they enter the building until the time they leave. And the rooms are sanitized. All the equipment in the room is sanitized between each patient. We have more frequent cleaning of some of the more common areas, so the waiting room, door handles, throughout the day. We also have instituted telemedicine appointments for patients who need them. So patients who need to see a genetic counselor or a diabetic nurse practitioner, if they come to the office and get their ultrasound, then we have those appointments on a computer screen like this, like what we're doing now. We know that the more people you interact with, the higher the risk for contracting COVID-19. So this is a way to prevent or minimize, I guess I would say, the number of people they come into contact with at our office. And then actually more recently, starting last week, we purchased these medical grade HEPA filtration systems, and we've put them all over the office, in the ultrasound rooms, and in some of the more high traffic areas. Yeah. And these systems have actually been shown to be 99.9% efficient at capturing these airborne viral particles that have been associated with COVID-19. So, the data and the research is constantly evolving with this virus, and we're trying to evolve with it to keep patients safe, patients and staff safe.
No question. You're rolling with the punches for sure, and you've implemented these safety measures as soon as you possibly could at High Risk Pregnancy Center. And obviously, having been a prospective parent walking through the door with my wife, we knew, it's a kind of a stressful thing already. So this kind of adds a little bit of stress to that, but you're doing your part to help make sure it's as least stressful and the most enjoyable experience as possible.
Right. Correct.
Yeah. Awesome. Where are you located in the Valley?
Well, we have 3 offices. So we have one, the one I'm at today is off of the 15 and Rancho. We have an office in Henderson, and then we have an office off of 215 and Sunset. Then we also have an office in Reno that we take turns going to, but it's a little bit.
That's a little bit of a drive. Yeah, I don't know if we'll be taking that trip.
Yeah. That's right. Yeah.
It's great to have you, and continued success to everyone there. And we thank you for the amazing work you did for our family.
Thank you.
All right. Hey, if you want to learn more about High Risk Pregnancy Center, you can go to hrpregnancy.com. Their number also there on your screen. 3 locations here in the Valley. High Risk Pregnancy Center, a proud sponsor of the Morning Blend.